Welcome to week 4, Psychodynamic Practice. These slides are prepared for SWK, Human Behavior in the Social Environment. This is your professor, Yvonne Ruiz, and the material on this PowerPoint slides are from the week 4 readings and from Malcolm Payne, Modern Social Work Theory. Psychodynamic ideas and concepts are prevalent in social work practice and in social work education because they emphasize the importance of people's internal processes, including emotions, cognitions, and their impact on behavior. And psychodynamic approaches are especially concerned with intrapsychic conflicts and internal patterns of behavior. One of the key concepts in psychodynamic approaches is that the past always influences what is happening in the present. So the central assumption of psychodynamic theory is that present behavior comes from past experiences, past events, past activities, and especially relationships in early childhood that form the personality in the present. So the main idea is that experience in early childhood, including traumas, including any kinds of experiences that left a deep and lasting impression, that these lead to behavioral and emotional difficulties, and that these must be resolved in order to move forward. And I want to add that the impact of these important experiences and relationships are often stored in the unconscious. So they impact on the present in ways that are often hidden. So more specifically, psychodynamic impact on social work practice includes the following. The influence of psychodynamic theory on social work can be seen in the emphasis on relationships and on an open, active listening style of practice. Psychodynamic theory uses a metaphorical structure of the mind. The id, which is the unconscious, the ego, which is how we cope and manage and adapt to our environment, and the superego, which in simplistic terms includes our morals, our ideals. And psychodynamic theory is a rich source of ideas for interpreting behavior. And psychodynamic theory is based on inference and interpretation of the client's own description of their thoughts, feelings, and behavior. The theory looks at the client's internalized cognitions and emotions as the way to resolve issues and change behavior in the present. So most recently, attachment theory has gotten a lot of interest and application in our work with especially children and adolescents, but attachment theory is also important through the lifespan. And attachment theory has its roots in psychoanalytic theory. So let's start at the beginning. The history of psychodynamic approaches are based in psychoanalysis. Now, that should ring a bell. You should immediately think about Sigmund Freud, and we'll get to him in a moment. But the history includes that psychodynamic theory is also based on a set of philosophical ideas about the self, about personality development, about how human beings function. And the unconscious mind is the key factor in understanding the client and the client's difficulties. And the main cause of conflict and anxiety that comes out in the present and in situations and relationships are actually hidden in the unconscious mind and have been planted for a long time since earlier childhood experiences. The unconscious mind is the main cause of behavioral issues and problems. And psychoanalytic concepts are both a practice theory and a theory of personality. And I will discuss this in a little bit more in some upcoming slides. So I thought it would be interesting to see Freud's clinical practice room. So you can see there's a couch, right, which is a kind of metaphorical therapist couch. You can also see that it's very Victorian with a lot of decor, a lot of stuff in the room. Victorians liked their stuff and their decorations. But you can see that Freud's chair is by the head of where the client would lie down. So the client or the patient, as would have been the term that was used at that time. So the patient would not look at the psychoanalyst. The patient would be looking at the wall, would be looking up, would not really have any eye contact with the psychoanalyst, and would, during the session, would be talking. This is the origin of the talking cure. And psychoanalysis relies on talking, on techniques such as word association, and the main idea is that by talking, the client is going to gain some insights into what is happening, and that the insights will lead to changes and resolving past issues. One of Freud's main contributions was his structural theory of the mind. And this is where we get the idea of the id, the ego, and the superego. These are metaphorical structures that the idea is that all mental activity is organized around the interaction of the id, the ego, and the superego. And that the interactions within the mind among these three generates dynamic tension or intrapsychic conflict. So how does this work? The ego, which is like the reality principle, mediates between the id and the superego. The id is the unconscious. It's our instincts. It's our desires. It is the repository of unresolved issues and feelings and impulses that are not acceptable in society. In contrast, the superego represents our consciousness, our conscience, our morality, our ideals, our better self, so to speak. And the ego balances out the tension that's created between the id and the superego, right? The id wants to eat the whole cake. The superego says, no, 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 just have one piece and leave some for other people. And then the ego has to make the decision. How much of the cake can you actually have? So that might be somewhat of a silly example, but it's an example of how the ego functions in our conscious mind. So it's important to understand that psychoanalytic theory is really based on the unconscious, right? So the unconscious is the largest part of the structures of the mind, and it also has the most influence. So there's a small area of consciousness, and you can see that in this image, where above the water, our thoughts, our perceptions represent the conscious level. There is a subconscious, right, which is just below the surface. Thoughts can break through. We have memories that are easily accessible, and we have perceptions, attitudes, and so forth that are in our subconscious, and we can access them. And then what's harder to access is the unconscious, or the id. And the id is where our fears, our strong desires, our unacceptable impulses, our kind of all of those hidden desires that we often repress and try to keep them in our unconscious and keep them from breaking through. So this is what psychoanalysis is really all about, is making the unconscious known. And Freud did that by letting people talk, by being a blank slate and letting his patients project onto him whatever was going on in their lives. And he would then, in his case studies, would interpret what they told him and interpret their behavior according to what he would think is going on in their unconscious minds. So just to recap, the id operates according to the pleasure principle, also operates according to aggression and sexuality. So primitive and unconscious parts of the personality are in the id. That's where they occupy the space. The ego operates according to the reality principle, mediates between the id and the superego. And the superego, morals, ideals, and conscience. So here's another depiction of the way these interact. Again, you can see that the ego has a small space kind of at the waterline, a little below the waterline, and the id has a lot of space below what can actually be seen. And in fact, the id can't be seen because it's hidden. So I mentioned that psychoanalytic theory is also a theory of personality. So according to Freud, those interactions among the id, the ego, and the superego is what forms our personality, is what determines whether we're able to be rational, stable, able to kind of resolve life's issues, able to interface with the social part of our lives in a way that functions and is competent and coherent. Or if the id is too powerful, we're going to be impulsive, we're going to give in to our desires on a frequent basis, we're going to have conflict with other people because we're in conflict with what is socially acceptable and the norms. And if our superego is powerful, we're going to be too rigid, we're going to be too idealistic, and that's also going to impact on how well we can function in our actual life environment. Sometimes people that have a very strong superego are called anal, right? Or they're repressed, or they are too rigid, authoritarian. So this slide on the power of the id reiterates some of what I've already talked about. We're unaware of what's going on in the id, but through talking, we can access what's happening. And if we can access what's happening, we can have insights into our motivations for our behavior, into what causes our repetitive patterns of behaving, thinking, and feeling. And once you can access that through insight, then that can lead to change. The unconscious consists of hidden ideas, and it is thought that they've been hidden because they have been too difficult, emotionally laden, and scary thoughts that we're unable to deal with. So we repress them and we keep them unconscious. So whether we're aware of them or not, whether we think about our unconscious or not, it is still there, and it has an influence on what we're doing, thinking, and feeling in the present. And the dynamic part of psychodynamic refers to tension, right? Intrapsychic tension, tension within our mental processes that is active, that is moving, that is changing, and that's having an impact on everything that we do. So, and dynamic in the sense they cause us to act, even if we're unaware of how we're motivated by our thoughts and feelings in the unconscious. So the id also contains drives. Drive theory is another Freudian concept, and drives are intrapsychic pressures which need to be relieved. So there's a drive towards pleasure. There's a drive towards aggression. And drives push us to act in order to resolve our needs. So if you think about behavior that you engage in repetitively, that often you know is not going to lead to a good outcome, but somehow you can't stop yourself from engaging in that argument, the same argument you keep having with your partner, or the same behavior that gets you into trouble. Sometimes we engage in relationships with the same type of person over and over again, and we create a similar situation. So those are patterns of behavior and thinking and feeling. And the reason that we keep engaging in that same situation is because we have a drive to resolve it. And the way we resolve it is by accessing the unconscious patterns that have actually led us to engage in that type of behavior. So the idea is that the unconscious is always trying to communicate with us. Our unconscious metaphorically communicates through symbols, through dreams, through things that keep coming up, that cause us to pay attention to what's happening, through anxiety, through discomfort, through that little feeling inside of you that, something doesn't feel good, something isn't right. That all of that is the way that our unconscious is communicating and trying to break through and give us information that we can access in our conscious mind, so that then the ego can use that information and actually make better decisions, function better, or resolve whatever problems need to be resolved. So this leads us to the ego as the executive function. So if you want to think of it that way, the ego is always trying to be in charge, is always the manager, is always trying to figure out, how am I going to manage this? How am I going to deal with this? How am I going to calm down the id? How am I going to appease the superego? So it's seen as, the book calls it a set of pragmatic ideas about how to understand and manage our social environment. It is our executive functioning. It's where we use our judgment. It's where we make decisions. It's where we set goals. It's where we analyze something in terms of strengths and weaknesses, in terms of advantages and disadvantages. It's really how we are able to function in the world. And especially in its ability to manage relationships. And relationships meaning relationships with colleagues, with people we work with our intimate relationships, with family relationships, and so on. So it's the interface with the world and interactions with others. And the ego develops through growth, and our capacity to learn from experience is an important way that the ego develops and gains strength. Our capacity to reflect on our experiences, our capacity to think critically and make those judgment calls, our capacity to understand reality and what's needed at any given moment, all of those are ways that the ego develops and grows and gains strength. An important feature of the personality is how the ego manages tension, conflict, and anxiety. So the skills that you have in problem solving, in dealing with difficult situations, in coping and managing our own internal fears and anxiety and discomforts, those are managed by the ego. So, psychoanalysis, the way that Freud practiced it, is not practiced in that way anymore. I mean, clearly it was, 150 years ago, even more. And in that time, psychoanalysis has evolved. So right now, psychodynamic practitioners are more active, more engaged. We mentioned when we talked about systems theory that as the worker, as the provider, you become part of the client's system. Whereas in psychoanalysis, the practitioner was outside of the patient's system. But with psychodynamic, the relationship and the therapeutic alliance and the ways that we understand the client and provide support and validation is really important. And Carl Rogers, who was a client-centered clinician, he developed that approach of being client-centered, talked about how the experience of a client that the worker is genuine, is warm, and is caring, and is authentic as really important parts of the relationship. So for psychodynamic practitioners, they're still using insight. They're looking to help the client gain a greater understanding of what's happening in their unconscious, what they're motivated by, what are the repetitive patterns of thinking, feeling, and behaving that they may not actually be aware of, and having an insight into a problem or a person or yourself is still an important part of psychodynamic practice. And understanding the role of anxiety and its cousin, ambivalence. Ambivalence is when you can't make a decision and you feel both two different ways about what's happening and you can't decide exactly what and how you're feeling. So these are derived from the inadequate resolution of problems that actually happens in earlier life stages. So in turn, these problems in early life lead to powerful feelings aggression, anger, love, that can actually overwhelm the ego with anxiety and ambivalence, as well as fear, anger, and love. But whatever they are, they interfere with daily life functioning. So the third practice concept on this slide is attunement. And attunement is also about being in relationship with your client. It's the process of appreciating and responding in an accurate way to the emotions and attitudes that lie underneath the service behavior of your client. So when you're in tune with something, you're aligned, you're on the same page, you have a common understanding. So these are the first three concepts of psychodynamic practice concepts. And there are two more slides of practice concepts. So this slide talks about defenses and resistance. So the ego needs to defend itself against experiences that trigger too much fear or anxiety. It needs to defend itself against an experience that is going to overwhelm the coping mechanisms and strategies that the ego employs, and ways that the ego needs to protect itself. We're going to talk more about ego defenses when we get to ego psychology later on in the course. So I'm not going to go into it too much. But, for example, denial is an ego defense. I'm sure you've heard about denial. You deny something or a situation that causes too much pain. And by denying it, you're actually protecting yourself from feeling the intensity that goes along with that situation. And then client resistance is also a barrier to working on life issues. Because when you're resistant, you're not going to be able to accept help that the worker can offer, or change in ways that allow for making better choices and having greater well-being. Transference is an important concept, and transference is when your client interacts with the practitioner in a way that represents a pattern of behavior that is actually part of early life experience. So those patterns of relating and behaving is transferred onto the relationship with the worker. That's why we call it transference. It's transferred. So understanding the ways that our client reacts to us is important to figure out, well, are they acting in this way because this is the way they reacted to an earlier event, or this is the way they reacted to their mom or dad or someone else in their life. So practitioners reflect on how clients react to them and how the reaction makes them feel. And this gives the practitioner information on what's going on with the client and what the client's patterns may be. So in psychodynamic approaches, understanding the transference of your client is a good thing, because that's where the work happens. Once you understand the emotions that they're transferring, or the behavior, or the thoughts, then you're able to name them and you're able to work on them. Transference happens unconsciously. It's not something that is decided on. it's the unconscious communicating and letting the client and worker feel what the client feels when they're interacting with someone in their life. When the practitioner transfers their feelings or behavior or thinking onto the client, that's called countertransference. So if your client sets you on edge, or if your client triggers you in some way, it's good to reflect and ask yourself, when have I felt this before? When in my life did this happen to me, or did I feel these feelings? Because through reflection, you can think, oh, I'm really treating this client as if this client was my mother or my father. They bring up the same type of feelings and triggers. So these are important concepts, transference and countertransference, and you're going to talk more about these as well. And then the last concept on this slide is working through. Working through refers to a process of talking about a particular situation, of remembering important examples of problem behavior, and deconstructing it, exploring it, examining it, looking at it, and then thinking about it in different ways. And by doing so, by working through in this way, you can think about what can be different. Working through can also help you reframe events that happened. So something that you may have always thought about in a negative way, working through it and gaining a better sense of what it is that happened and why you reacted that way can actually lead to changing your thinking about that and changing that negative belief. So these are also more psychodynamic practice concepts. Interpretation is one of the important techniques that's used, and through interpretation, there are observations that the practitioner makes about clients' behavior. And through interpretation, it actually helps clients to think in new ways. So the practitioner shares their interpretation of the client's thinking, feeling, or emotions, and gives them something new to think about, a new way of looking at it, a new idea, and that can lead to beneficial changes and new ways of thinking. Exploration. It is an in-depth description of behavior and events that also is about uncovering the onion. We often talk about peeling the onion, that there's always more. So you may have a particular event that happened that had a huge impact on your life, and you keep thinking about it, and the more you think and talk, the more you uncover, the more you can learn from it, the more you explore it, the more you can actually gain in understanding. A lot of psychodynamic practice is about going over things over and over again. And the aim is to really understand, have insights, and be able to make changes based on new ways of thinking. Then there's ventilation or venting. That's expressing strong emotions such as anger or fear. And we all need to vent sometimes, don't we? Ventilation happens. We need to let our feelings out. And venting can be cathartic. And cathartic is also another concept that means that when you release strong emotions through talking, through crying, pounding on that pillow, all of these help to vent out the emotions that are built up and the stress and the tension that gets built up inside and needs to be released. This is the last slide on psychodynamic practice concepts, and it's clarification, making things clear. This enables the worker or practitioner to seek more specific information to understand what the client is thinking, feeling, and experiencing. So we don't assume that we know what the client is saying, what the client is trying to convey or communicate. So we need to clarify by asking questions and by actively listening to the client. And then sustainment. So sustaining the client is about improving the client's self-esteem and self-confidence through support, understanding, being interested, being committed to helping your client, and also that the practitioner is confident that the client can make changes and the client can make progress. So we seek to sustain our clients, and we also want to sustain the gains that our clients make during our work with clients. So these are 11 practice concepts that really are part of both psychodynamic theory as well as psychodynamic practice. So the pain chapter also presented Brandel's work from 2004, and I really like this model of factors in psychodynamic treatment. It all starts with understanding what the problem that the client brings, understanding what the problem is, and assessing for the range of factors that have led the client to seek help at this particular time. Like, why is the client seeking help now and not 5 years ago when the problem started emerging? Or why now and not last year? So we always look at the timing when we're meeting with a client, whether it's because they're in crisis or whether it's other factors in their life. It's important to understand what else is going on. So you may recognize what I just said as also understanding what's happening in the client's social context that is impacting upon the problem. Number 2, understanding how the client deals with the world outside, how the client's able to adapt, cope, and what is their kind of emotional status, the emotional responses they make to solving problems, difficulties in relationships, and being able to function in their life. So what are the strengths of the client is another way of looking at this. What are the resources that the client has? Understanding how the ego functions in managing the tension between the id and the superego. So that also means, how does the client deal with external threats and difficulties that they encounter? Do they respond in ways that are aggressive or fearful, or that they're too open and accepting? So you need to understand that. Number 4, how cohesive is the client? The client's view of him or herself is stable and coherent. And to what extent is their personality consistent and organized? For example, have they been able to meet important goals in their life? Are they able to recall what happened in the past and talk about it, and also explore difficult situations and tolerate strong emotions? As well as, can you as the worker tolerate strong emotions and the intensity that often comes when clients are talking about the difficulties in their lives? Also, starting in the second column, what are the strengths and weaknesses in the client's psychological functioning? You're going to build on strengths, and you're also going to work on helping to improve and increase the weaknesses that they may be encountering. Areas of life that the client is not dealing with effectively. So you need to understand what they're doing well and the areas where the client feels that they're not dealing with well. And the practitioner's emotional response to the client, being aware of your responses, being aware of your feelings about the client. What are your impressions? What is it how does the client make you feel? So that's also an important part of acknowledging, to check if there's any countertransference. And then there's treatment planning. How are you going to go about helping to solve the problems or deal with life difficulties? What needs to happen and how does it need to happen? In other words, treatment planning is setting goals, objectives, and interventions to meet those goals. So psychodynamic practice is all about the therapeutic relationship. And it's a reciprocal relationship. It goes both ways. You need to build rapport and you need to build trust with the client. So that means that you as the therapist, you need to use empathy, being able to put yourself in the client's shoes and understand what they may be feeling and how they may be responding to things. You need to be genuine and warm with your clients so that they feel that you are a person who wants to help them and who supports and validates their experiences. Confidentiality, you need to make sure that your client knows that what they disclose to you, what happens during the times that you meet, is confidential so that they can share not only the things that are easy to talk about and disclose, but more importantly, those things that are difficult to talk about, whether it's about oneself, whether it's about events that happened, whether it's about ways of thinking and feeling that the client may not want to acknowledge. And then there's unconditional positive regard. And what that means is that your work is approached in a non-judgmental way, that you are there in the client's best interest, that you are going to be able to listen and be present. And, I think of it sometimes as you're holding hope. That part of what we do as practitioners is we witness clients when they're at a low point in their lives, maybe, or when they're having difficulty. They may not like themselves very much. They may act in ways that make it hard to listen and to sit with a patient. But as the therapist, as the social worker, we still hold on to hope that things are going to change and improve, that the client can make progress, and that we are going to respond to them in ways that are empathic and are genuine. And then for the patient, we want the patient to have insights into what's going on through the interactions with us and through talking. We want patients to be honest about what's going on in their lives. We want patients to be persistent and keep working within the therapeutic relationship, because sometimes it's hard to keep going, right? Clients sometimes drop out at a point where it's hard and they're, on the verge of a breakthrough, but they may get scared, they may feel it's too much, they may get overwhelmed, and so they drop out. So we also want to foster that persistence and motivation to change. So among the strengths of psychodynamic approaches is that it's a rich source of ideas and material and ways of discussing and looking at details and looking at different aspects of the client's life. So it's a rich source of material to look at in treatment. And exploring the past can really help to motivate clients to make changes. Understanding what happened, how it happened, why it happened, being able to acknowledge the ways that people's reactions and the ways perhaps that the client, him or herself, reacted also impacted on a particular situation or relationship can really help to move forward and make changes. It can be helpful to understand what's happening in the present with suffering, grief, difficult feelings, when you can look and identify some of the root causes or identify what some of the influential factors were that led you to what's happening in the present. So leading to greater insight, greater understanding can be helpful. Helping clients make sense of what might be incomprehensible. Clients often, I don't understand why I do this. I don't really know what's going on, but stuff comes out of my mouth, or I behave in ways without even thinking. And you as the practitioner can help clients make sense of what's going on internally, intrapsychically, so that they can think about things in new ways and make changes. And finally, helps to understand the origin or the source of current conflicts and suffering. So it can be helpful to go back and explore important events in one's life, look at particular times and particular relationships, and have a greater understanding of how they've shaped the client's life, their choices, and their opportunities, and why they're thinking and feeling and behaving in the ways that they are. So these are some strengths. One of the major critiques of psychodynamic practice is, where is the social work part? So some of the critiques are that psychological factors and interventions are overemphasized in these approaches. Social context and environmental factors are minimized, if recognized at all. Psychodynamic ideas limit emphasis on social reform and social activism, which represents a major element of social work practice, and the assumption that the client's problems arise from inadequate mental functioning, poor problem solving, poor ego functioning, or just weak ability to set goals and follow through. So these are some of the critiques, and the critiques lead to understanding the limitations that are important to understand. So interventions are a talking therapy, and talking and expressing oneself is an important part of engaging in psychodynamic treatment. So therefore, this type of treatment is most helpful for clients who are verbal, who can express themselves well, and who can engage in self-examination. That may leave out some clients. The second bullet point is that it's oriented towards more long-term mental health services, and it's less appropriate for short-term help or problem solving, or situations where the focus is on delivering social services or concrete services. So if client has time and agrees to engaging in a longer-term relationship of a few months or maybe even years, psychodynamic approach can be helpful because it's generally slow moving. It takes time to establish a therapeutic relationship, to begin disclosing and begin to going deeper into one's internalized conflicts and sources of conflict. And psychodynamic approaches are non-directive. The practitioner does not really engage in a lot of feedback. There's a lot of active listening. Generally, they don't provide or organize concrete services towards change. So it's a lot of talking. And in my practice, I've had clients say, how is this helping? I'm just talking about things. I'm talking about the same things every week. So you need to explain to your client what's happening and why it's important to keep going over particular situations. But clients can get tired of the process. Focusing mainly on the psychological can also result in victim blaming and can affirm cultural, racial, and gender stereotypes. So it's easy to blame something on poor mental functioning, on inadequate resources, internal resources to set goals, to cope with, to strategize, and to make changes. So clients are sometimes blamed for the problem as if they're orchestrating what is happening. So that needs to also be recognized if and when that happens. And there's a lack of empirical support for using psychodynamic approaches. Why is that? It's because there is an emphasis on the relationship, and the therapeutic relationship or therapeutic alliance can be difficult to quantify. So, in general, it is thought that psychodynamic approach is effective and is able to help clients a lot, but there aren't a lot of systematic studies that are generalizable. And that's important. Systematic, generalizable, and able to be replicated, meaning that can you study the exact same variables, the exact same factors in the exact same way with another set of practitioners and clients and get the same results? That can be difficult because psychodynamic approaches focus on the uniqueness and the individuality of our clients and the individual ways they respond to situations in their lives. So these are the limitations of the theory. This is a very quick run through psychodynamic approaches. Realize that whole courses are taught on these approaches, and I have done this in less than an hour. So we will continue the discussion in our Zoom room. Thanks for listening this far.